Meeting of the Health and Human Services Committee to order. Please stand for the Pledge of Allegiance. I pledge allegiance to the
Pledge allegiance to the flag of the United States of America, for which it stands, one nation, under God, indivisible, liberty and justice for all.
Thank you. We will move on to public comment, and there is nobody present here, and we had nobody signed up for public comment. So then on to item number 4, approval of the March 1st, 2023 Health and Human Services Committee meeting minutes. Those were in your packets. So do I have a motion? Motion by Covelli, second by Arstead. Is there any comments, changes, discussion? All right. Seeing none, all those in favor of approving the minutes, say aye. Aye.
Aye.
Opposed? All right, none opposed, motion carries. Item number 5, policy issues, discussion, and potential committee determination. 5A, from NCCSP Board, resolution of support for utilization of state surplus funding to offset supplemental payment decrease. And I thank Administrator Leonard.
Yes, thank you, Madam Chair. Within your packet, there is information from North Central Healthcare, and I do serve, just a little bit of context, both on the Executive Committee of the North Central Healthcare, North Central Community Programs Board, and the Community Programs Board itself. This is an issue that, we really went from having an opportunity for increased funding for operating the nursing home that the county operates, or that North Central operates on behalf of the county, I should say, on the Lakeview Drive campus, to a situation where, due to some changes in how the funding was allocated at the state level, where we actually have a lack of funding, a net loss, or essentially a wash. The resolution within your packet, beginning on page 3, is a resolution that was reviewed by and considered by the North Central Community Service Program Board, the North Central Healthcare Board. That was done last week. It was approved by that board and is being sent to our area legislators, and it was also suggested that this committee and ultimately each of the counties consider it as well. Again, as set forth in the resolution, which does a very nice job, that Executive Director Gary Olson put together, does a very nice job spelling out the changes at the state level, essentially the reduction in those supplemental payment and CPE funding payments, really put the counties and North Central Healthcare in some pretty difficult financial positions. And essentially, we're requesting that the state utilize their surplus funding to fill those gaps that were created, and also develop a long-term funding source to make sure that county-operated nursing homes continue to be a viable thing for the counties to do, because there is a very important role that they fill. So if you have any questions, I'll do my best to answer them. But again, this was considered by the North Central Community Services Program Board, adopted, and also sent to the counties for consideration. If you've been watching in the news, Lincoln County, their board chair has been pretty vocal with local representatives and the media explaining this problem, and Chair Gibbs has spoken quite a bit about it to various committees, most notably the HR Finance and Property Committee. But happy to take any questions, Madam Chair.
Thank you. What questions do we have, Supervisor Covelli?
Thank you, Madam Chair. So it looks like the deficit was about $3.5 million. Is that correct?
Between the two counties, North Central operates the nursing home for Marathon County and for Lincoln County. But yes, total, the loss of those supplemental payments and the CPE payments is $3.54 million.
Okay. With that decrease, was there a decrease in services as well?
No. So the best way to describe this is a decrease that happened. It was budgeted that we would have these increased Medicare and Medicaid payments. It was not budgeted that we would see these decreases. So it isn't a financial problem as of yet. But as is set forth, I think it's in this resolution. If it's not, it's very well known to certainly Chair Gibbs and myself, and to the HR Finance and Property Committee. Our contract with North Central Healthcare to operate the nursing home, the county's contract, says that any deficit will be filled by the county. The nursing home business, if you don't know this, at least from the county side, it's not a money-making venture. Nobody is getting rich in the nursing home business, particularly given the populations we serve. So the contracts that we have, the management contract that each of the counties have with North Central Healthcare, essentially says North Central Healthcare will operate, but the counties will make sure that North Central is not financially harmed in doing so, so any losses have to be made whole. North Central is going to be seeking, if the state doesn't come through and kind of reinstitute the CPE and supplemental payments, this North Central is going to be seeking those funds from each of the two counties, from Lincoln and from Marathon. But there hasn't been a change in service at all. It's just a change in what will be a change in budget impact. I mean, the services that nursing homes deliver are very highly regulated, and certainly we're going to continue to deliver the high-quality care that North Central Healthcare is known for, but we do need to address the funding issue. And a great number of counties, as set forth in the resolution, were negatively impacted, 21 counties, and we had a couple counties that, based on the changes at the state level, that really had a large influx of funds.
Okay, thank you for that.
And I just point out that chart on page 3, Mount Views, it looks like their deficit is just under 2 million. The other one is for Pinecrest. Go ahead, Supervisor Arstead.
So do we know what the surplus is for the state?
Well, I was referring to the state, the surplus you've heard about in the budget discussions, and depending on who's making the statements, the numbers sometimes change, and the real big debate is how much of that is ongoing money as opposed to one-time money. But the number that I've heard discussed frequently is $7 billion. The shortfall that we're talking about here, I can't recall if it's in the resolution, but across the state, in terms of nursing home shortfalls, I want to say that I'll hear you in the second whereas it talks about $39.1 million in funding at its disposal for fiscal year 2022 and 23. So it's not a significant percentage of that overall budget surplus that is talked about in the budget building process.
And do we know if other counties are asking for that?
I haven't heard that. So just in terms of strategy, Gary Olson drafted this, Executive Director Olson drafted this resolution. Chair Gibbs has spoken with Wisconsin Counties Association a fair amount. There are, as referenced in this resolution, about 21 other counties that are significantly impacted in a negative way. So certainly Wisconsin Counties Association is aware of it, but I am not aware of any other county taking a resolution at this point and sending it to their legislators. We are going to take this and forward it to Wisconsin Counties Association if we actually haven't done that already, just to make them aware of kind of the tact that we're taking. I would anticipate other counties would do the same thing.
Thank you.
And Lance, is Lincoln also, they're also reviewing this resolution, Lincoln County?
Madam Chair, there was a request to send this resolution to both Lincoln and Marathon County boards
Okay.
for consideration. So I don't know if they've taken any action on it yet, but certainly the discussion has been had in Lincoln County. I don't know if Vicki has anything to add, but as I referenced before, the Lincoln County Board Chair, I believe he gave an interview to several media sources about this very topic.
Okay, and since this is just a resolution to, send for an ask, essentially, it doesn't matter if one county declines it versus both of them doing it?
From a practical matter, it would just perhaps influence the number of legislators that it would get sent to, because we're going to send it to the legislators that have, that represent portions of Marathon County.
Okay, thank you. Are there any other questions? Anyone online? No? Okay, so if there aren't any other questions or discussion about this agenda item, it looks like we are being asked to make a determination today. So we would be taking a vote to forward this to the full board for consideration. So is there a motion? Motion by Arstead, is there a second? Second by Supervisor Covelli. Are there any other comments? Okay, seeing none, all those in favor for forwarding the resolution on, say aye. Aye.
Aye.
Aye.
Opposed? None opposed, motion carries. Thank you. Thank you, Lance.
Thank you.
Okay, item number 6, operational functions required by statute, ordinance, resolution, or policy. We have none today. Brings us to item 7, educational presentations and committee discussion. We'll start with 7A, acceptance of grant funding for health department anti-tobacco/vaping activity. And we have the health officer here today to share some information with us.
Yes, thank you. So in the packet, you have a white paper entitled Juul Settlement Fund in Marathon County. So it was found that as a result of an investigation, it was found that Juul was accountable for targeting marketing of vaping and tobacco products to youth. And as such, that they had to pay a fine for that. And Department of Health Services plans to receive at least $14.7 million over the next 5 to 10 years as a result. So the Department of Health Services has been allowing counties to reach for grant funding. We did actually present a grant, and it was granted for $29,675. We did so as the fiscal agent of the Nicotine Prevention Alliance of Central Wisconsin, which is an alliance between Marathon, Wood, and Portage counties. This grant would actually promote activities around smoking cessation in colleges and high schools, specifically in regards to vaping and electronic nicotine delivery devices. So it does have promotion of cessation resources that are happening in colleges, electronic nicotine delivery systems, disposal kits, and of course, educational outreach to retailers. This is an extension of our existing tobacco prevention activities, and it would be really funding only the materials and resources needed. The staffing continues to be existing health department staff that are health educators that are listed in the white paper. So we are moving forward. We'd like to have this budget amendment made so that we can continue on and start the activities listed within.
Thank you. So for us today, this is just an educational item. It will be going to HR Finance for approval to move on to the full board for that budget amendment. But are there questions, or are we interested in having discussion about this today with Laura? Okay, thank you. All right, 7B, April is Family Strengthening Month in Wisconsin, and what that means for our local social services department. We have our new social services director with us today.
Good afternoon. Thanks for having me. So as Madam Chair shared, April is Strengthening Families Month, formerly maybe known to you as Child Abuse Prevention Month. And so in front of you was not in your packet, but what I provided is a proclamation from Governor Tony Evers indicating that April is Family Strengthening Month. So you have that, as well as in the spirit of strengthening families, they have provided a 5 and 5 challenge. And so you have sort of a calendar in front of you to use during Family Strengthening Month as an opportunity to focus on family strengths. And so this is something we'll be providing families and have as a flyer available, really just encouraging families to spend good time together, because we know that that is one of the 5 protective factors. And so this is really encouraging those different protective factors to exist within families. So we'll be sharing those as resources, as well as having a Hands Around the Courthouse event. We have had those in the past. We took a little bit of a break due to COVID, but we are back with our 5th annual Hands Around the Courthouse event that will take place on Tuesday, April 25th from 4 to 5 p.m. here at the courthouse. And so this is really to show the community strength in numbers and show our families how supportive we are of them. You've heard about different programming that we're doing in our community through social services, really encouraging families to stay together and putting funding towards in-home services. So this is just a great opportunity to show and to create awareness around those different events. So this will be a rain or shine event. We're asking individuals to wear blue in support of this cause. March 31st, was Wear Blue Day, leading up to April being Strengthening Families Month, but we're asking just for another demonstration of wearing that color in support. The other thing that Social Services is doing is we have put forward 4 donations for the Neighbors Place. So we've involved our partners, such as law enforcement, in doing donations for the Neighbors Place because they support so much of what our families do. We have different boxes at locations that would be picked up and delivered in May.
Great, thank you. Does anybody have any questions? Go ahead, Supervisor Causey.
Yes, does anyone know of any speaker programs, workshops, and things on child abuse for the month of April? I'm thinking it would be really nice if different groups and departments that are involved with child abuse could give presentations, maybe at NTC or at North Central Healthcare, or at the Center for Civic Engagement.
I am not aware of any, but maybe you can speak on, what kind of education your staff gets throughout the year, not just this month.
Sure, yeah. So Marathon County Social Services provides mandated reporter training to multiple different providers in our community. So sharing signs, things to look for, as well as how to report and what it means when cases do come through social services, providing some education. The women's community also does quite a number of events during April because it's also Domestic Violence Awareness Month. And so we tend to collaborate, knowing that domestic violence and child abuse have such contributing factors to one another. We tend to collaborate. There's nothing at NTC, as you spoke of, that I'm specifically aware of, but certainly is something that we could consider for future years in doing events and involving our community.
Thank you. Are there any other questions? Okay, thank you for all of that information. And then again, we're all invited to the 5th annual Hands Around the Courthouse on April 25th from 4 to 5 p.m. here. It's item 7C, update from NCHC Managing Director of Community Programs, which we all know is Vicki Tilka. What is our desired future state and how do we intend to achieve it is what she'll be talking about today.
Thank you very much for having me today. Lance is passing around a laminated copy of the desired future state that I'm going to talk about. So in my position, I think most of you were at the last meeting that we had at North Central Healthcare, and we were able to have the tour too. So I talked about my position at that time, but just in a very big picture, I oversee all of the behavioral health programs that are inpatient for youth and adult, crisis stabilization for youth and adult, community treatment, so that's case managers going out in the community to work with individuals, and then outpatient services and adult protective services. And all of our crisis programs that go with that, with our crisis center and crisis stabilization. So it's a very wide array when we talk about our behavioral health community programs. The executive committee of the North Central Healthcare came up with this desired future state for the community program specifically, which is really to guide my position in the programs that I will oversee to this end. And it's really an exciting vision for us. We've used this internally and externally with our partners and want to make sure to share that with you today. So I'm just going to highlight some pieces of this for you. The keys here is that we're working together with our 3 counties seamlessly in delivering human services. And I say that seamlessly because behind the scenes is what we're talking about in terms of when we coordinate services and connect our systems better. We individually provide great services to people through our counties and through North Central Healthcare, and at times we could do better in terms of coordinating behind the scenes. The second line here I want to emphasize is inpatient services, because I think you know that North Central Healthcare is very unique in human services in terms of having inpatient services, inpatient hospitals, and that, again, very unique in Wisconsin, and we're fortunate to have that. And at the same time, we want to be clear that our inpatient services are to support and stabilize our community members in order to get them back in the community. And that's really, again, our whole continuum of services. Our focus is to serve people in the community, and we look at our target population, behavioral health and AODA. Then we look at it from our social services lens, child welfare, youth justice. We do adult protective services at North Central Healthcare, and then connecting with our partners in the criminal justice system, which is huge. So this will positively impact the work of our partners, which is law enforcement, the courts, schools, and our medical partners. when we look at our focusing on services in the community, we get the best outcomes for people. And it's what people want. They want to receive services in the community, in their own homes when possible, certainly, but in other community settings when that's not possible. That's what we would all want. That's what everybody wants. And the law actually says we need to serve people in the least restrictive environment. And it's usually more cost effective. So it's win-win in all of those things. So that's helping us focus of what really we're moving forward to do. So as I've talked to many groups about this, everybody's like, this is great, this is empowering. Nobody could disagree with this, right? The question is, how do we achieve it? So just to let you know, a couple of things that we already have in place that will help us to move this forward in the next several years. And I'm saying that on purpose because it will take several years to really strengthen all of our partnerships to the point that I think we all feel comfortable in. And first I want to say that we're redefining the we. So when we talk about we, we're not just talking about North Central Healthcare, we're talking about the counties together with North Central Healthcare and looking at so we can be more human services like in our delivery. We are in the minority of counties in terms of not having a combined human services department. So we need to pay more attention to that and be able to formally connect our services better. That's really what these efforts are all about. So one way we're going to do that is we have initiated a human services leadership team, which is only with 6 people on a team, so a small but mighty team. It's the 3 directors of our social services department, so Krista's part of that, as well as myself, and then our financial director at North Central Healthcare, Jason Hake, and then it will be our medical director, Dr. James Billings, who has started as our interim medical director. He will join us periodically as well. So that is the team that is already meeting and defining our core services that North Central Healthcare needs to provide by statute, and out of those which are most important from a county perspective for us to prioritize to work on first. So that's what we're engaging in that work already. That's one group. The other piece is coordination with law enforcement. And our criminal justice population, specifically with law enforcement. I've been working with our Sheriff's Department and Wausau PD primarily so far, and engaging the Langley County Sheriff just very recently, and some of our other local law enforcement jurisdictions in Marathon County will be coming next. And what we intend to do in May is have a meeting with our law enforcement leadership to better educate about what North Central Healthcare does, because there's lots of changing in the programs, as I think you know some of, and lots of literally moving in the building in terms of where they'll access crisis and things like that, but lots of new programs and enhanced programs that we want to make sure everybody understands. So it'll be educational, and then we'll also be talking about some identified issues that law enforcement has that are pressure points for them so that we can figure out how we can work better together there. I'm also part of the Criminal Justice Coordinating Council and working with our other criminal justice partners in terms of understanding what their needs are and where North Central Healthcare fits into that as well. The other piece that I'm already quite deep into is looking internally at North Central Healthcare and how we can best coordinate our services internally. Working for Marathon County for 35 years and being the director for 17 years, I knew the scope of North Central Healthcare was big, but I really had no idea how big until I was there. And Laura's smiling because she worked there before. It is so huge. I mean, just the number of employees, but the programs and the depth of the programs and the challenge of connecting all of those programs internally when they're all under different statutes and different requirements, different certifications, different regulations. It's challenging. So that's the other third part of the bucket is finding out ways internally to do that so we have better alignment within North Central Healthcare. So those are the 3 huge pieces that I'm working on at this point, and in the next couple of months, I hope to have my work plan finalized that I will present to the executive committee after being approved by the executive director, Gary Olson, to be able to show really where I think we'll be able to go in the next couple of years. So that's my introduction after being there for 3 months.
Thank you, Vicki. What questions do we have for her today? Go ahead, Supervisor Krause.
It was sort of fast for me to write all that down, so I'd remember it. But could you mention again who is on your human services team? Is that your team, who they are and what departments they work in and what they're responsible for?
Sure. So first of all, it's myself. It's my job to help to support that committee. So it's me, and then internally at North Central Healthcare, it's Jason Hake, and he's our financial director, and then our medical director as well. So those are the three people at North Central Healthcare. And then it's the three social services directors for the three counties. So Krista Jensen here in Marathon County. Jessie Rumsey is the new interim director for Lincoln County. So she has joined us once so far. And then John, and I'm not going to be able to say his last name, from Langlade. Can you say it? Yeah, she's saying Zekovich, something like that. I call him John Z, so I'm sorry. I'll have to learn how to say his last name. His background there is their Veterans Office, and he's been the director of Langley County Social Services for maybe about a year, something like that.
Okay, are there any other questions? Okay, I just had a couple, Vicki. So you mentioned that other counties have a countywide human services department that exists. What does that look like in other counties? Or do you know?
Oh, yes, I know
Okay.
very well, actually, because I've been involved with social services, again, for such a long time. So the majority of counties, I believe it's only 12 counties that do not have a combined human services department. So basically, you have the child welfare side, I'm going to call it, which is what social services does with child protective services and youth justice and economic support. Traditionally goes there as well. Child support's a wild card where that might end up. But that's basically your child welfare kind of pieces. And then you have your community programs. So again, a separate set of statutes that govern what human services does. And that's basically the treatment and support for behavioral health and AODA services and developmental disabilities. So in most counties, all of those services are in one organization, not necessarily under one roof, depending on how large the organization is, but in lots of counties, it is under one roof. And so, again, a shared budget, shared leadership, staff that work together. It's a model that, again, most counties have, and even those, I don't know what percentage didn't start that way, but over time have migrated to that. Wood County was like probably about 7 years ago, something like that, became a human services department, for example.
Okay, and I'm assuming that we don't operate that way because of the unique structure of North Central Healthcare?
Yeah, I'll take a little bit of that. The short answer to your question is yes. Building on what Vicki said, I believe it's like 62 of 72 counties do not have a joint, I'll say it that way, don't operate in a joint community programs fashion, which is what we do. I mean, there's us, there's Unified, and there's the Vilas Forest one. So there's only 3 entities, as I understand it, that are multi-county community programs entities. And a lot of counties, not only, like Vicki said, combine child welfare and community programs, they also add the health department and some of those health and human services departments. To Vicki's point about being unique, we're unique in the 2 fashions she referenced. One, we have an inpatient hospital. We're also only one of a handful of counties that have that. We're very fortunate to have the breadth of services we can offer. The way we do that is we combined with other counties, because that sort of stuff is expensive if you're doing that all yourself. It's still expensive if you're doing it in partnership. It's rare, but it's a really nice asset to have. The flip side of that is we're unique in that we're one of only those handful of counties that don't have it under one roof, figuratively or literally. The benefit of, the benefit of being under one roof, one of them is, like Vicki said, that idea of coordination and budgeting. It's all one pot of money. Whether it's even a different budget, it's all viewed similarly through the budget process. It's a little bit of a struggle with the system we have. And I shouldn't say a struggle, but it's just different challenges. I mean, we might have an intervention opportunity that when you look at the entire process, is the far more cost-effective way to deal with an issue. Like Vicki said, it's far more cost-effective, and you have better outcomes to deal with people in the community. but the cost of engaging in that work might live in the North Central healthcare budget, and the benefits might be conferred upon the county in a different department. So it's a little bit, it requires stronger relationships, which kudos to Vicki and that leadership team that she talked about, that Supervisor Krause asked about, that coordination. It's going to take more affirmative effort to do that than it might, at least in my experience, in a single county health and human services or human services approach. But North Central's been around for a lot longer than I've been around. And the county's talked about, just like Vicki said, making that transition. Is this the best method to go through? And in 2016, I think, was really the last time that conversation was had and the decision was made. Strengthen the partnership. And I think this is the best way to look at all the work that we're doing at North Central and that Vicki's leading on the community program side, is all about strengthening that partnership, strengthening that coordination.
Thank you. And then, Vicki, my other question, or I guess maybe request, is you talked about speaking with law enforcement and educating them on the programs that exist, but then you also talked about just like the wide variety of programs that amazed you when you came there, and you've been with the county for so long. So is there a way that through this process, we can be better at engaging the community as a whole at what exists? Because I think a lot of people know just a small portion, or maybe nothing if they've never been involved at North Central Healthcare. So how do we make it so community members know what resources exist for them, and not just people in criminal justice or people, in police, that sort of thing? So maybe that's, you don't have to answer, but maybe a request thinking about that as you move forward with this plan is, how do we engage community too?
That's a great question, and I think that we have to do that piece by piece. We just met with DC Everest school leadership yesterday, or 2 days ago, I don't remember. They wanted to use our building for a meeting. They're getting around to the community, and we were able to talk with them and remind them about the programs or update them. So I think it is kind of piece by piece to some degree. The other thing that I'm sharing is that our website is really very good and very up to date. And there's a referral form on the website that is so simple for people to fill out to refer either themselves for services or someone else. And then we can figure out what program they might be eligible for. And what I have found out is that so many people don't know that. So I keep sharing that. It's very simple. And even partners that I would expect would know that don't know that. So just certain things like that. And then as we can spread this out, like with the social services directors, for example, they are spreading that out through their departments and with other partners. So I think somewhat it's the grassroots type thing. And that's what I've figured out so far, I guess. But we can, look at things where we can be present if there's community meetings and things like that. But that's where I'm saying it's almost kind of biting off a chunk at a time.
Yeah, makes sense. Thank you. Are there any other questions for Vicki? Okay, thank you so much, Vicki. Seeing no more questions, then item number 8, next meeting date and time, announcements and future agenda items. 8A, committee members are asked to bring ideas for future discussion. 8B, our next meeting is Wednesday, May 3rd, 2023 at 3 p.m. Brings us to item number 9. I'll take a motion to adjourn.
Supervisor Connering, I make a motion.
Thank you, Supervisor Gonnering. Second by Supervisor Gonnering. All those in favor say aye. Aye. All right, we're adjourned. Thank you.